Welcome back to another edition of the Hart2Heart Podcast. And today's episode is going to be a solo episode that I'm going to be doing on aging. A lot of people are really interested in how to not age these days and how to age more slowly. There's lots of even Netflix series on this now. Brian Johnson has this famous Don't Die documentary that a lot of people are interested in. It's become very popular in the biohacking community. How can people slow down the aging process? Because obviously, people don't want to age. They want to look younger. They want to feel better. They want to live a healthier life overall. And so what I'm going to be talking about today are some practical ways that you can slow down aging. But before we get into that, let's talk about what aging is overall. What is aging exactly? And it's the accumulation of cellular damage. So what I'm going to be talking about today is how to actually slow the process of aging in your cells. Okay, because that's where the real magic is, and that's where we can really slow down the aging process. So over time, our body accumulates these damaged proteins, these dysfunctional mitochondria, and we also get what's called zombie cells or senescent cells. And basically what those cells are is those cells that just won't die. They're still there, they're not dividing anymore, but they're putting out things into our bodies that are very inflammatory. And so, we need to get rid of those. And I am going to be chatting about that later on today. But, the big things that we're going to be talking about are to slow down aging are two major things. So one of them is going to be called autophagy, which you may or may not have heard of before. A lot of people are using this through fasting, and I'm certainly going to be talking about that. And then the other thing is I just mentioned is Senolysis, or breaking down those senescent or zombie cells. And so, those are the two big ways that we can really reduce aging at the cellular level. And once we can do that, then we can really slow down the whole aging process. So let's just get right into it and get into the first topic. So like I said, there's two major topics. And the first one is going to be autophagy, which you may or not have heard of before. So, before we talk about how to slow that down, let's just talk about what autophagy is. So we know that this is the body's kind of self-eating process in the cells. So cells break down and then they have these damaged organelles within the cells. So for example, mitochondria, that's an organelle within the cell that you may have heard of before. So mitochondria, what do? They produce ATP. ATP gives us energy. So what we want to do is we want to have very, very efficient mitochondria. We don't want to have damaged mitochondria that aren't producing ATP. We want to be able to clean that up. And so that's what autophagy can do. Now, there are a lot of things that you can do to, improve or increase autophagy and make sure that you are, cleaning up those cell organelles. And so, one of them I briefly mentioned, and that is fasting. So, a lot of people are fasting these days and they're either doing it, for 16 hours, or some people are even going, more for 24 hours or longer. Now, there's good news and bad news to this. So the good news is that, fasting does work. Like I said, it's an extremely efficient way to clean up our cell organelles or to induce autophagy. But there are some, things that, are not so good about fasting. And the big thing is, the kind of disappointing thing is that if you're only fasting for 16 hours, it's not going to induce that much autophagy. Okay, so it's really when you get to 24 hours and, there's a lot of magic that happens after 48 to 72 hours. And that's just, a little bit impractical for a lot of people. So I'm not saying that you're not going to get any benefit from fasting for 16 hours. You're definitely going to get some, but compared to 24, to 72 hours, you're going to get a lot more fasting, a lot more autophagy. So, just something to consider. Now, I'm not saying that, you should stop doing the 16-hour fasting if you're doing it, primarily for autophagy. You will get some benefit, but just not like the benefits you'll get, say, at 24 to 72 hours. And so, what are some other ways that we can improve autophagy or speed up autophagy? So, a lot of people want to know about some supplements, and we are going to talk about those, but we'll talk about more behavioral factors first. So things like heat and cold. So getting into the cold plunge, if you do about 3 to 5 minutes around 50 degrees or less, you're definitely going to be revving up your autophagy system. And the other way, and actually when you're doing the cold plunge as well, you're also increasing something called mitochondrial biogenesis. I actually talked about that in the last podcast that I did. So not only are you going to be inducing autophagy and cleaning up these cell organelles. And so, for example, one of the cell organelles I mentioned would be mitochondria. So that would be called mitophagy because they're cleaning up the mitochondria. But in addition to that, with the cold plunge, you're also actually producing new mitochondria. So pretty incredible benefits with that overall. Now, some people don't like the cold. I understand that. They're more interested in using heat. So sauna therapy or revving up, your body's heat temperature, especially when you get past about 39 degrees, even past 38, you do start to induce a lot of heat shock proteins. But when you get up to 39, it's even a little bit greater overall. And when you get that body temperature up, you will be able to induce autophagy and then get that cellular cleanup going. So those are some of the major ways that we can do things behavioral. But in addition to that, I know there's a lot of people who are listening to this podcast that are really into exercise and fitness. And, one thing that can really help with the cleaning up the cell organelles and inducing autophagy is actually doing high intensity interval training. So, there's various different ways that you can do that. And I talked about that, and briefly in the last podcast, but, doing things like Tabatas where you're going, 20 seconds, just all out, and I mean all out, and then 10 seconds off. And then doing that for 8 cycles overall can be really helpful for a lot of people for not only improving their cardiovascular fitness, but also for inducing autophagy. So those are some of the main ways. Also too, just in keeping with the behavioral modifications and in line with the diet would be ketosis. So when you do get into a state of ketosis, and a lot of people will, get a state into ketosis when they are doing, a 16-hour fast sometimes. So you almost get a little bit of a, 2 for 1 there because you're getting the fasting, but you're also getting that ketosis benefit in some people as well. If you want to check if you're in ketosis, there's various different ways that you can do that. There's pee sticks out there that you can pee on. There's various different ways that you can check that. One question that people are probably going to ask is, what about using like ketone salts or ketone supplements? Yes, those can actually be effective for inducing autophagy. And so, if you want to use that in the morning on your fast, that's a very effective way to induce autophagy, get that cellular cleanup going. So those are sort of some of the main behavioral ways that we can induce autophagy. And one thing I should mention as well is that, going back and forth in the heat and the cold can be very effective for that. So if you are someone that, has a cold plunge and has access to a sauna, going back and forth can be really effective, really powerful way for inducing autophagy and getting that cellular cleanup going. Of course, a lot of people are going to ask too about supplements. And probably the most powerful supplement is one that you may or may not have heard of before. That has a very odd name. It's called spermidine. Spermidine is something that was only really been recently popularized because we didn't really know the benefits until fairly recently. I've seen lots of people talk about it. I may be familiar with Dr. David Sinclair, who's, sort of one of the godfathers of aging, we could probably say. And he indicates that, this is something that's can be very effective overall. Now, most of the studies are in mice, but it does seem to extend life. And basically what this does is that, when you take the spermidine, it's going to essentially mimic the effects of fasting. And so that's, part of the reason why it's so effective. And then the doses range from that is very wide. It seems to range from about 1 to 10 milligrams a day, but 10 milligrams does seem to be very safe. And the other nice part about this is that it's actually a fairly inexpensive supplement. So it's not something that's really difficult to come by. You could probably get it on various different websites like iHerb or even Amazon, wherever you get your supplements. I actually try, not to get my supplements on Amazon. I do think that, Amazon's amazing and, there's various different products that I get from there, but, you can potentially get some false products from there or some products from there that you are ordering that are fake. And so that's why I prefer to get it from, different online retailers such as iHerb. But coming back to, what else can, induce autophagy and slow down our overall cellular aging. So another one of Sinclair's favorites, berberine. So berberine is something that you may have heard of before. It's very similar to metformin. Metformin is a type 2 diabetic drug. And so berberine is mostly well known for lowering hemoglobin A1C or lowering our blood sugar levels and keeping them stabilized, and it is effective for that. It's not something, unfortunately, that I like to use at this point, just because that it can actually reduce the ability to burn muscle. And then also too, unfortunately, it can reduce the effects of mitochondrial biogenesis that you get through zone 2 cardio, which I talked a little bit about last week. So zone 2 cardio is the most effective way for increasing new mitochondria, for making new mitochondria through mitochondrial biogenesis. But, because it has those effects, it's not something that I really recommend overall or something that I play around with. But if you're someone who, really wants to, get into autophagy and really, clean up those cellular organelles, maybe doing it a few times a week, 500 milligrams or so, is something that I think is reasonable overall. What about some ones that may be a little bit more practical? Quercetin, you may have heard of before. A lot of people started finding out about this over COVID because it helps zinc get into the cells. So it's a zinc ionophore, which can be helpful for our overall immune system in combating different viruses. And so quercetin, taking about 500 milligrams or more a day can be really effective for inducing autophagy. People will often take quercetin with something called bromelain or bromelain. And so that can help just increase the overall absorption overall. In fact, there's a lot of supplements now that combine the two to make sure that people do get the proper absorption of that. Other things that people have found to be effective for, or research indicates to be effective for inducing autophagy, be green tea. The effective ingredient to that is EGCG. People are taking between 300 to 800 milligrams a day for that. Again, that's not something that I personally take, because there are some studies, mostly animal studies, but indicating that it may have some disruption to the overall testosterone and androgen hormone system. Again, I really want to maximize my testosterone and hormones. And so, it's not something that I personally take, but I do want to mention it just for completeness of this discussion. Then we have resveratrol. Resveratrol has become popular recently, or maybe over the last 10 to 20 years now. That's the ingredient that has been found in red wine that a lot of people seem to talk about, in terms of why there's some benefits to drinking red wine. And you would have to, drink an insane amount of red wine in order to get the benefits of resveratrol. So for that, I do recommend obviously getting it in a supplement form as opposed to, getting it through red wine, just because of all the devastating consequences that would come from drinking excessive amounts of alcohol. And the dosage for that is usually around 500 to 1,000 milligrams a day. Again, these are, dosages that seem to be effective for, inducing autophagy. You may find that some of these dosages may seem to be a little bit high, but these are more so for inducing autophagy. That is something that I have used in the past before. It was resveratrol. It doesn't seem to have too many detrimental effects if it's something that you've used before and have had detrimental effects, let me know about it. Certainly in the comments somewhere. Um, Another one that's very popular is curcumin. So curcumin does have excellent evidence for reducing overall inflammation. I've seen patients have high CRP or high inflammation levels. They've taken curcumin, it's lowered their CRP and lowered their overall inflammation. So CRP is C-reactive protein, which is an inflammatory marker. And they have had success with reducing that down, and it does seem to induce autophagy. Usually around 1,000 milligrams a day is what a lot of people are taking with that. It's not something that I like taking because, again, it can disrupt the testosterone or androgen system, particularly decreasing DHT or dihydrotestosterone. I've talked about, DHT and dihydrotestosterone before. So yes, DHT can be linked to, hair loss and prostate growth, but it's also incredibly beneficial for overall confidence, mood, muscle building, libido. So it has all these amazing benefits. So it's not something that I want to decrease. One way that people are, decreasing this, that they may not know that when they're decreasing DHT is by taking something called Propecia or finasteride. And so, that's what people take again for hair loss. And sure, it may help with the hair loss, but you are getting a lot of detrimental effects when you're taking that because you're lowering your DHT and you may be, lowering your libido, lowering your mood, lowering your cognition, your overall executive function. So it's not something that I encourage people to take. In fact, I usually try to get my patients off of it when I learn that they are taking it. We've talked about autophagy and how to induce autophagy. But what are some other ways that some of the benefits of getting autophagy or of inducing autophagy? So, it's actually can be really good for our metabolic health overall. So it can increase our insulin sensitivity and our mitochondrial function. And so, what does that really mean? So when your insulin is more sensitive, we're able to use glucose better, and our mitochondrial function, that's going to improve our overall energy. And so, there are examples of this when people have, say, restricted calories and it's been increased their autophagy markers, and it's also reduced the risk of type 2 diabetes. So, we talked earlier before about, fasting. Fasting, goes kind of hand in hand with caloric restriction to many degrees. And so, we already have some real world evidence that, just by inducing autophagy, you can potentially increase or improve your insulin sensitivity and improve your overall mitochondrial function. What else is autophagy good for? So it's also good for our brain health or for neuroprotection. So it can remove those amyloid plaques that are linked to Alzheimer's disease. So, incredibly important for people who are, prone to Alzheimer's or have a family history of Alzheimer's. Getting rid of those amyloid plaques is something that, you want to do to reduce your overall risk. And there have been studies in mice that have shown that when they have fasting-induced autophagy, it has reduced their overall chances of Alzheimer's. So, incredible research there overall. But it's not just about your metabolic health or your brain health. In fact, there are other benefits. So even muscle recovery. So reducing, oxidative stress overall. A lot of athletes are using saunas and they're using cold to help overall with their performance. And they do find that it can be very beneficial for improving their overall recovery. And some of that they think is due to this process called autophagy. So, that's part of the reason why a lot of athletes are doing the cold plunge and doing the sauna, whether they really know it or not, they are inducing autophagy and they are getting better overall recovery. And lastly, and maybe most importantly for some people, immune system regeneration. So, fasting, we know, especially when you get into that 2 to 3 hour day window, that can regenerate your white blood cells, and it can kill your old dysfunctional immune cells. And so, there's cancer patients actually who have fasted for 2 to 3 hours before they've done chemotherapy, and they've actually experienced fewer side effects and had a faster immune recovery overall, which is pretty incredible. So, when you put it all together, it makes sense to try to do what you can to induce autophagy and make sure that you're not accumulating dysfunctional cell organelles overall. So I said that there was, 2 different ways to really reduce cellular aging. So we just went through autophagy. And what we're going to do now is we're going to go over the second way. So this is the senolysis, or targeting those zombie cells. And so these cells are cells that basically refuse to die. And so what these cells do, though, unfortunately, is they're not really generating anything very productive or generating, say, much ATP through mitochondria. But what they are doing is that they're putting out these pro-inflammatory cytokines. And so basically things that cause inflammation. And as we know, we do want to reduce inflammation overall. I just mentioned CRP, or C-reactive protein, earlier, and ways that how, say, something like curcumin can reduce that. And just a quick note on that, people may want to know, so how can I reduce CRP if I'm not, if I don't want to take curcumin like I do? I take something called boron. So boron has been shown to reduce CRP, or C-reactive protein. And another great beneficial effect of boron is that it can actually reduce SHBG. And so what's that it's going to do is it's going to drive up your free testosterone. So you kind of get a 2-for-1 there. So with the boron, you get a decrease in inflammation, and then you also get an increase in your free testosterone. But coming back to these zombie cells, or the senescent cells, they are going to accumulate. They're going to increase our risk of cardiovascular disease, of aging, of arthritis, neurodegeneration. So again, we want to clear those out of our system. And this is, again, one of the 2 ways that we can really reduce aging at the cellular level. And so by, clearing out these zombie cells, we are going to consequently reduce inflammation and chronic disease overall. And there's actually trials that show that when people take a certain supplement, which I'm going to get into, it can reduce overall systemic inflammatory markers by about 40%. So, let's get into, how we can induce senolysis. So there are a few different compounds out there that can help with this. But again, before we get into that, what we'll do is we'll talk about some of the behavioral things that we can do. So some of them actually overlap, which is great. So, the things that you do for inducing autophagy are also going to help clear out those zombie cells, or those old dysfunctional cells. So exercise, again, high intensity interval training, excellent for clearing out those zombie cells, getting rid of those cells that aren't doing you any good, that are just putting out inflammatory increasing inflammatory markers in your body by increasing the cytokines. So in addition to the exercise, also again, heat. So getting in the sauna, getting that body temperature up, somewhere between 38 to 39 degrees Celsius, really effective for clearing out those zombie cells. And also, as we mentioned earlier, obviously effective for autophagy. So you get another 2-for-1 there. So fasting, again, is very effective for senolysis, or clearing out those zombie cells. But unfortunately, again, it's not more like the 16-hour window that a lot of people do, and it's more in the 24 to 72 hours. That's where kind of the real magic happens with those, with that particular protocol. Now, let's talk a little bit more too about saunas. So, one of the big reasons that, people are talking about saunas these days, and, I had Dr. Roger Schweltz on the podcast recently, and he discussed this and, why he believes saunas are so effective for improving overall longevity. There actually have been studies that shown that a dose-dependent response to using saunas, so meaning that people who use saunas, say 7 times a week versus 4 times a week, have a lower overall mortality rate. So they get a lower risk of dying just by using the sauna. And it seems to increase the more you use it. So meaning the more you use the sauna, the lower your overall risk of mortality and the more benefit that you seem to get. So, incredible thing that, people can be doing. If you are someone who, doesn't have, access to a sauna, hopefully it's something that you can get access to in the future. And it doesn't have to be, a big fancy sauna. There's even some, great even heat blankets and small kind of portable home saunas you can even get on Amazon that can be effective for getting that body temperature up. So, hopefully the price on those comes down even more, so it's even more accessible for people. But let's also talk about some supplemental ways that we can also get rid of those zombie swells and increase the senolysis. So there's a couple different supplements that I mentioned earlier, but one of the big ones is fisetin. So that's fisetin. And now this is a little bit different. It's not something that you would take every day. So this is something that is generally done through cycling. So, if many of the supplements that I mentioned earlier, those would be overall once a day or twice a day use. These ones here are more like you do it like 2 to 5 times a month. So you seem to get better results when you cycle it in a month as opposed to just use it daily. So one of the big ones I mentioned actually earlier was quercetin. Again, something that became popular over COVID for increasing zinc into the cells, is zinc ionophore. But taking about 2,000 milligrams a day, 2 to 5 days a month, seems to be effective overall. And especially when you combine that with fisetin at about 1,500 milligrams a day for 2 to 5 days a month. Or you can do it based upon your body weight, which is probably a little bit better. So that's usually around 20 milligrams per kilogram a day. So it is a high dose, but again, you're only taking it for about 2 to 5 days a month. And the first time you do this, you may experience even a little bit of fatigue just because your body is clearing out all of these old cells that you've had your whole life. Okay, so if you do decide to do this, just kind of be on the lookout for that. You may have a little bit of fatigue, you may feel a little bit off, but that is completely normal. Other things that you can do as well is you can actually, if you can get your physician to prescribe this to, obviously this is, not medical advice. This is something that I want you to do on the care of your doctor, but there is a drug called dasatinib. So it's a pharmaceutical drug. It's obviously, it's mostly used for actually leukemia patients, but it seems to be effective for inducing senolysis and clearing out those zombie cells. And so people often use 100 milligrams one day to maybe up to 2 to 3 days per month. And they will combine that with quercetin somewhere in the range of 1,000 milligrams a day. And the two combined seems to be very, very potent at inducing senolysis. So again, not something that I think that you should do on your own. Obviously, even getting access to that drug is almost impossible without the care of a physician. But doing that will, in fact, induce senolysis and really help you clear out those zombie cells overall. So, some people will then want to ask, should I do, both of them at the same time, some kind of protocol to, induce autophagy or induce senolysis at the same time? That's something that a lot of people are still debating over, but many times people will say, no, don't do them both at the same time. So do just your, cycle of the quercetin and the dasatinib. That's what you're doing, or the fisetin on its own, and do the senolysis. And then the other things that you can do with the autophagy, you can do those on days where you're not doing the senolysis. And of course, like I've chatted about before, you're just going to be naturally doing this sometimes all the time, meaning that you're going to be doing both the senolysis and the autophagy all the time anyway, because there are some of those behavioral modifications that do seem to overlap one another. The fasting, the sauna, the cold therapy, all the things that I was mentioned earlier. So between the two, you should get, excellent results overall for, clearing out those zombie cells, for inducing autophagy and clearing out those dysfunctional cell organelles. And then also just for, improving your overall rate of aging and hopefully just improving your overall health as well. And so, coming back to senolysis, so what effects can you expect, when you are getting into the deepest senolysis and getting rid of those zombie cells? So, we chatted a little bit earlier. I mentioned how fisetin, that was the supplement that can show about a 40% reduction overall in inflammation and inflammatory markers such as CRP. But in addition to that, when they have looked at mice studies, they found that when mice were treated with some of the senolytics that I mentioned earlier, it actually increased their lifespan by about 36%. So again, not done in humans, but it seems to be excellent overall in terms of the efficacy in animal models and mouse studies. And it doesn't just help, in some of the joints and helping decrease arthritis or pain, like I was mentioning earlier, but also too for improving your overall skin health. And so, that's something that a lot of people are interested in these days. So the senolytics, they'll clear those damaged cells and they'll improve collagen and tissue repair. So you may find that over time that your skin starts to look better and healthier overall. It can also improve your cardiovascular health. So when you get these zombie cells, it will stiffen up your arteries, potentially cause high blood pressure. And when you get those senolytics going, it can improve your vascular elasticity and lower your overall blood pressure. So excellent for people who are struggling with hypertension or high blood pressure. And lastly, too, it does work on the brain. So when you're clearing out those zombie cells, you're going to get less neuroinflammation and you're going to get less of that tau protein that I talked about earlier. And that will potentially reduce your risk of getting Alzheimer's disease. So those are the main ways that senolysis will have positive effects on the body overall. And, in terms of, what to do going forward with all this information, obviously I gave you quite a bit of information today. And, I'm not saying that you have to do all of them at one time to get the benefit. But what I am saying is that if you, take a couple of them and you find that, you're getting some great results, then just keep going with that. But if you find that you're not getting the results that you're looking for, then you can potentially just keep adding things to it and you can see how that goes overall. So guys, I hope you enjoyed this podcast and I hope that you got some good takeaways here on how to decrease your aging overall. And I hope that you start inducing autophagy and start getting rid of those zombie cells. So thank you so much for watching and listening to this video. And as always, I'll be back with another episode soon.